How coronavirus affects mental health and what can you do? Pandemics can be stressful. The coronavirus disease (COVID-19) pandemic may be stressful for people. Fear and anxiety about a new disease and what could happen can be overwhelming and cause strong emotions in adults and children. Public health actions, such as social distancing, can make people feel isolated and lonely and can increase stress and anxiety. However, these actions are necessary to reduce the spread of COVID-19. Coping with stress in a healthy way will make you, the people you care about, and your community stronger. Stress during an infectious disease outbreak can sometimes cause the following: 1. Fear and worry about your own health and the health of your loved ones, your financial situation. 2. Changes in sleep or eating patterns. 3. Difficulty sleeping or concentrating. 4. Worsening of chronic health problems. 5. Worsening of mental health conditions. 6. Increased use of tobacco, and/or alcohol and other substances. Everyone reacts differently to stressful situations. How you respond to stress during the COVID-19 pandemic can depend on your background, your social support from family or friends, your financial situation, your health and emotional background, the community you live in, and many other factors. The changes that can happen because of the COVID-19 pandemic and the ways we try to contain the spread of the virus can affect anyone. People who may respond more strongly to the stress of a crisis include: 1. People who are at higher risk for severe illness from COVID-19, for example, older people, and people of any age with certain underlying medical conditions. 2. Children and teens. 3. People caring for family members or loved ones. 4. Frontline workers such as health care providers and first responders. 5. Essential workers who work in the food industry. 6. People who have existing mental health conditions. 7. People who use substances or have a substance use disorder. 8. People who have lost their jobs, had their work hours reduced, or had other major changes to their employment. 9. People who have disabilities or developmental delay. 10. People who are socially isolated from others, including people who live alone, and people in rural or frontier areas. 11. People in some racial and ethnic minority groups. 12. People who do not have access to information in their primary language. 13. People experiencing homelessness. 14. People who live in congregate group settings. Take care of yourself and your community. Taking care of your friends and your family can be a stress reliever, but it should be balanced with care for yourself. Helping others cope with their stress, such as by providing social support, can also make your community stronger. During times of increased social distancing, people can still maintain social connections and care for their mental health. Phone calls or video chats can help you and your loved ones feel socially connected, less lonely, or isolated. There are healthy ways to cope with stress. 1. Know what to do if you are sick and are concerned about COVID-19. Contact a health professional before you start any self-treatment for COVID-19. 2. Know where and how to get treatment and other support services and resources, including counseling or therapy, in person or through telehealth services. 3. Take care of your emotional health. Taking care of your emotional health will help you think clearly and react to the urgent needs to protect yourself and your family. 4. Take breaks from watching, reading, or listening to news stories, including those on social media. Hearing about the pandemic repeatedly can be upsetting. 5. Take care of your body. Take deep breaths, stretch, or meditate. Try to eat healthy, well-balanced meals. Exercise regularly. Get plenty of sleep and avoid excessive alcohol and drug use. 6. Make time to unwind. Try to do some other activities you enjoy. 7. Connect with others. Talk with people you trust about your concerns and how you are feeling. 8. Connect with your community or faith-based organizations. While social distancing measures are in place, consider connecting online, through social media, or by phone or mail. Know the facts to help reduce stress. Knowing the facts about COVID-19 and stopping the spread of rumors can help reduce stress and stigma. Understanding the risk to yourself and people you care about can help you connect with others and make an outbreak less stressful. Take care of your mental health. Mental health is an important part of overall health and well-being. It affects how we think, feel, and act. It may also affect how we handle stress, relate to others, and make choices during an emergency. People with pre-existing mental health conditions or substance use disorders may be particularly vulnerable in an emergency. Mental health conditions such as depression, anxiety, bipolar disorder, or schizophrenia affect a person's thinking, feeling, mood or behavior in a way that influences their ability to relate to others and function each day. These conditions may be situational, short-term, or long-lasting, chronic. People with pre-existing mental health conditions should continue with their treatment. If you think you have new or worse symptoms, call your healthcare provider. Call your healthcare provider if stress gets in the way of your daily activities for several days in a row. Free and confidential resources can also help you or a loved one connect with a skilled, trained counselor in your area. Different life experiences affect a person's risk for suicide. For example, suicide risk is higher among people who have experienced violence, including child abuse, bullying, or sexual violence. Feelings of isolation, depression, anxiety, and other emotional or financial stresses are known to raise the risk for suicide. People may be more likely to experience these feelings during a crisis like a pandemic. However, there are ways to protect against suicidal thoughts and behaviors. For example, support from family and community, or feeling connected, and having access to in-person or virtual counseling or therapy can help with suicidal thoughts and behavior, particularly during a crisis like the COVID-19 pandemic. Recovering from COVID-19 or ending home isolation. It can be stressful to be separated from others if you have or were exposed to COVID-19. Each person ending a period of home isolation may feel differently about it. Emotional reactions may include 1. Mixed emotions, including relief. 2. Fear and worry about your own health and the health of your loved ones. 3. Stress from the experience of having COVID-19 and monitoring yourself, or being monitored by others. 4. Sadness, anger, or frustration because friends or loved ones have fears of getting the disease from you, even though you are cleared to be around others. 5. Guilt about not being able to perform normal work or parenting duties while you had COVID-19. 6. Worry about getting reinfected or sick again even though you've already had COVID-19. 7. Other emotional or mental health changes. Children may also feel upset or have other strong emotions if they, or someone they know, has COVID-19, even if they are now better and able to be around others again. Here are some tips and advice that we hope you will find useful. 1. Keep informed. Listen to advice and recommendations from your national and local authorities. Follow trusted news channels, such as local and national TV and radio, and keep up to date with the latest news from World Health Organization on social media. 2. Have a routine. Keep up with daily routines as far as possible, or make new ones. For example, get up and go to bed at similar times every day. Keep up with personal hygiene. Eat healthy meals at regular times. Exercise regularly. Allocate time for working and time for resting. Make time for doing things you enjoy. 3. Minimize newsfeeds. Try to reduce how much you watch, read or listen to news that makes you feel anxious or distressed. Seek the latest information at specific times of the day, once or twice a day if needed. 4. Social contact is important. If your movements are restricted, keep in regular contact with people close to you by telephone and online channels. 5. Alcohol and drug use. Limit the amount of alcohol you drink or don't drink alcohol at all. Don't start drinking alcohol if you have not drunk alcohol before. Avoid using alcohol and drugs as a way of dealing with fear, anxiety, boredom and social isolation. There is no evidence of any protective effect of drinking alcohol for viral or other infections. In fact, the opposite is true, as the harmful use of alcohol is associated with increased risk of infections and worse treatment outcomes. And be aware that alcohol and drug use may prevent you from taking sufficient precautions to protect yourself against infection, such as compliance with hand hygiene. 6. Screen time. Be aware of how much time you spend in front of a screen every day. Make sure that you take regular breaks from on-screen activities. 7. Video games. While video games can be a way to relax, it can be tempting to spend much more time on them than usual when at home for long periods. Be sure to keep the right balance with offline activities in your daily routine. 8. Social media. Use your social media accounts to promote positive and hopeful stories. Correct misinformation wherever you see it. 9. Help others. If you are able to, offer support to people in your community who may need it, such as helping them with food shopping. 10. Support health workers. Take opportunities online or through your community to thank your country's healthcare workers and all those working to respond to COVID-19. Don't discriminate. Fear is a normal reaction in situations of uncertainty. But sometimes fear is expressed in ways which are hurtful to other people. Remember, be kind. Don't discriminate against people because of your fears of the spread of COVID-19. Don't discriminate against people who you think may have coronavirus. Don't discriminate against health workers. Health workers deserve our respect and gratitude. COVID-19 has affected people from many countries. Don't attribute it to any specific group. If you are a parent, what can you do? In times of stress, it is common for children to seek more of your attention. 1. Maintain familiar routines as much as possible, or create new ones, especially if you must stay at home. 2. Discuss the new coronavirus with your children in an honest way, using age-appropriate language. 3. Support your children with at-home learning and make sure time is set aside for play. 4. Help children find positive ways to express feelings such as fear and sadness. Sometimes engaging in a creative activity, such as playing or drawing, can help you with this process. 5. Help children stay in contact with friends and family members through telephone and online channels. 6. Make sure that your children have time away from screens every day and spend time doing offline activities together. Do something creative, draw a picture, write a poem, build something. Bake a cake. Sing or dance, or play in your garden, if you have one. 7. Try and ensure that your children do not spend significantly more time than usual on video games. If you are an older adult, what can you do? 1. Keep in regular contact with loved ones, for example by telephone, email, social media or video conference. 2. Keep regular routines and schedules as much as possible for eating, sleeping, and activities you enjoy. 3. Learn simple daily physical exercises to do at home when in quarantine so you can maintain mobility. 4. Find out how to get practical help if needed, like calling a taxi, having food delivered or asking for medical care. Make sure you have a 1-month supply or longer of your regular medicines. Ask family members, friends or neighbors for support, if needed. If you have a mental health condition, what can you do? 1. If you are being treated for a mental health condition, make sure that you continue to take medication as prescribed, and that you have a way of restocking your medication. If you see a mental health specialist, find out how to continue with that support during the outbreak. 2. Keep in touch with people who care for you and know who you can contact for support if your mental health declines. 3. If you are being treated for an alcohol or drug use disorder, be aware that the COVID-19 outbreak may lead to increased feelings of fear, anxiety and isolation that can increase the risk of relapse, substance use, disengagement from treatment or non-compliance with treatment regimens. Make sure that you continue to take medication as prescribed, particularly if you receive treatment with opioid medicines such as methadone or buprenorphine, and that you have a way of obtaining a regular supply of your medication. If you are receiving support through a psychologist or support group, find out how to continue that support during the outbreak. 4. If you are being treated for gaming or gambling disorder, continue with your treatment if possible. Check with your therapist or health care provider about the best way of continuing with therapy during confinement at home. Give it a thumbs up if you like the video. Share this with someone who you think may find this video helpful. Subscribe to the channel for more tips. Thank you for watching.